Some people get admitted to hospital when actually they don't really need to be admitted to hospital. And if we could provide more care for them at home and coordinate that care between various different agencies, so district nursing, social care, mental health and general practice, we could look after them safer in their own homes.
Integrated care works by joining up care for people. That can be with professionals working together in the same place and talking to each other about the care they're providing for a person, or it can be through a single point of access, which is what we've just set up here in Surrey Heath. So this means that from the point of referral, the point that someone's needs are told to us, we look at their care in a joined up way rather than just in an individual service or specific type way. And that hopefully means they get a better response from the start and only have to tell their story once.
Hello, Integrated Care team, Denise speaking.
So a referral will come in. That could be from a GP, it could be from a hospital. In some cases it will be from a person who uses the services. It will have a basic description of what their needs are and what their predominant need there and then is. And the administrative staff will then identify who that should go to in the duty room.
It's come via email and it looks like it's really urgent.
So there's lots of clinicians and practitioners that sit in the duty room and they'll look at that referral and decide whether we could perhaps join up services by involving other services or professionals in that person's care.
We've just received this urgent referral from the GP Park Road Surgery. It's about a lady, she's living on her own, self-neglecting, she's not eating very well. When we're at the spa, we are working with all different professionals under one roof. We've got community matrons, we've got rapid response, we've got OTs. And when we get referrals, we do the screening, we find out who is the appropriate professional to deal with that referral.
We're able to actually liaise with our colleagues much quicker. They're sitting in the room and if we've got a problem, we can actually talk to one of them and that can be referred on to the most appropriate person as well. We had a call. The lady felt she had to go into hospital. The OT was on call here with me from Rapid Response and we actually both went out together because I felt, no, maybe she doesn't need to go into hospital.
And so we had a nursing assessment and we had a therapy assessment and we were actually able to keep that lady at home that night, liaise with the GP from the patient's house to be able to get a review from the GP the following day. Her pain relief was much, much better the following day when I spoke to her and I believe we avoided having her admitted to hospital.
So if I find someone who I think would really benefit from integrated care, on my computer system now there's a template where lots of the information is already populated. I can now send that via an email to an integrated care team or to the single point of access. I can then also follow that up with a phone call where I can speak to a professional. So it's made it quicker, it's made it simpler and it's much more coordinated.
Yes, having all the other disciplines around is very helpful. When we get complex referrals in, it's a great help to be able to put lots of heads together and work out how best to take a referral forward.
The single most important thing to me is that now people are referring people's needs and not worrying about what services they need to support them. This means that they can just phone up and talk to us about the needs that someone has and we'll do all the hard work working out how we're going to support people with those services.